I had been recently married. I had a happy marriage. I have a very happy life, but I was starting to get depressed. I was really losing interest in sex.
Things were just difficult. Life wasn't as good as it was. Sex wasn't as gratifying, fulfilling. It was definitely affecting everything.
In my early 20s, I was diagnosed with premature ovarian failure. It basically means that I entered menopause very early in life, and due to that, had the same symptoms as a 50-year-old woman. No doctors understand or know what premature ovarian failure was at the time. They did not know what to do with a 20-some-year-old woman that was in menopause.
I initially went to my OBGYN, and during my yearly examination, I brought it up to him that I was having a problem. I was losing interest in sex. I was having a hard time having orgasms, and I just wasn't, feeling satisfied at all. And I was looking for some kind of answer.
Female sexual dysfunction, or FSD, is a medical condition that is complex and often misunderstood and misdiagnosed. Symptoms include a decrease in desire, arousal, sexual excitement, and decreased lubrication, difficulty or inability to experience an orgasm, pain during intercourse, and lack of sexual satisfaction. One or all of these symptoms can cause women distress and affect their overall well-being.
It was tough, and the more we tried, the more frustrated we both got, and the more frustrated we both got, the less we would try having sex, because it just really got to a point where it's not going to work anyway, so why even bother trying?
I was experiencing vaginal dryness, lack of lubrication, thinning of the vaginal walls, those things that are associated with menopausal women. I tried estrogen creams, progesterone creams, testosterone.
More than 43% of American women experience sexual dysfunction at some point in their lives. These women represent a cross-section of ages ranging from adult to postmenopausal. Psychological and past or present relationship factors can negatively affect sexual function. However, a high percentage of FSD is due to physical conditions, such as hormonal imbalances, menopause, trauma to the pelvic area, and side effects from medications. Chronic medical conditions such as vascular diseases, high blood pressure, and diabetes can also cause FSD. All these factors should be considered when diagnosing and developing a treatment plan for FSD.
No one had any answers, and it was, okay, you're under too much stress. You need to have a little relaxation, chill out, and it'll go away. Well, it doesn't go away. We went through a lot of stress with, not knowing who it was. And my husband had seen an ad in the paper. He said, here, I think you need to check into this and see if it's something that can help us here. So he gave me the newspaper clipping and I called on it.
Eros therapy is a small, handheld, clinically proven medical device. The Eros uses a small, soft, caress cup that fits over the clitoris. A gentle vacuum is activated, which increases blood flow and sensation to the clitoris and genital area. The vacuum level is adjustable to suit a woman's preferences. The Eros therapy is safe, highly effective, and convenient to use. The Eros is designed to use in the comfort of your home without intercourse to condition your sexual responses. It can also be used prior to intercourse to improve clitoral and genital sensation, vaginal lubrication, orgasm, and your overall sexual satisfaction. There are no known side effects reported when used as directed.
When I first saw the Eros, it was very small, very compact, fit in the palm of your hand, and it did look like other toys and devices that we've tried using to stimulate myself. And it was, okay, another one, is it going to work? but using the arrows has actually worked, has helped.
I was worried about taking anything orally. I did not want to be taking something else that has dangerous side effects. I was really looking for something that was more of a device or a therapy.
It really mattered to me that they went ahead and did clinical studies too, because there's a lot of stuff out there on the internet and in the drugstore that, there really aren't any claims. And for them to say that, it actually, increases lubrication and sensitivity and ability to achieve an orgasm, I mean, they actually say that, and it's because they did these trials. If you use it as directed for a 60-day period, therapeutically, exactly the way you're supposed to, and if you're not satisfied, then they allow you to return it for a full refund.
I used it every day for about 10 minutes every day, sometimes in the morning, sometimes before sex. But it does take a while for it to start changing your body back to the way your body's supposed to be.
Once you've used it for a while, it gets to be almost second nature. And it's not a tough thing to use. It's very simple, very easy.
It's just a natural way to recondition our sexual responses, and I would recommend it to anyone that has those symptoms that we've all been talking about, and go to your doctor and ask them about it.
Finding the Eros was very important for just my mental health, and having this kind of sexual dysfunction, having it have something that I can do for myself.
Don't just give up. Don't just say, okay, this is something I need to live with and accept it, because you don't have to live with it.
Using the Eros device really gives us a chance to take control of our bodies. It's something that we're using. It's something that we control when and how we use it. It's something we can choose to share with our partners or not share with our partners. I mean, you get to control all of that depending on your feeling, depending on your cycle, depending on a lot of different things, just within your life. So it is empowering.
There are solutions out there, and try the Eros.
After using the Eros device we've been using it now for about 2 years, things are back to normal. Things are like we were when we were first married. We're back to a good, healthy sexual life again. We enjoy each other. We're back on the same track. Life is very good. Very good.